Time now for our second midday foreman. Joining us is Bob Rauner with Healthy Lincoln. And today we're going to be talking about a brand new initiative. It's been out for about a month, and we're talking about cancer screenings.
Yeah. So basically there's a national effort called 80% by 2018, trying to get more people screened for colon cancer.
Okay.
Specifically in Nebraska, that's actually one of the areas we are behind most other states. We have more colon cancer than other states because for various reasons, but at the same time we lag on screening. And so a group of Lincoln physicians decided to create a project where we would try to be the first community in Nebraska to hit 80% by 2018.
Awesome.
We're also going to do breast cancer screening though too. So we're launching a project. We now have about 30 clinics and about 200 primary care providers that are going to participate. We're doing it partly in cooperation with the county health department, which is working on getting more screening kits in pharmacies, for example.
Okay.
And then even Governor Ricketts did a press release a week or two about the importance of colon cancer screening.
And we were there for that. And now when it comes to this, who's eligible? Who are you guys trying to target? Is it 80% of the people who are a certain age bracket?
Yeah, the age bracket is between ages of 50 and 75 for colon cancer and breast cancer too. Those are probably two of the most solidly supported cancer screening methods out there. Colon cancer specifically is really important because you can actually, with some of the screening methods like colonoscopy, actually prevent cancer in the first place by removing it in the polyp stage. So we're working with clinics. I'm doing about 3 to 4 clinic launches a week now. One of the clinics we were at last week, the family physician, Dr. Marlon Weiss, was telling me about one of his patients where I think the wife tried to convince the husband he needed the screening, so they both did it together, but she was the one who actually got diagnosed with cancer and is finishing treatment. And so by catching it early, it may have saved her life, actually.
And now when it comes to kind of the payment for these kind of things, a lot of times is it Medicaid, Medicare, does it kind of cover it, or how does that work?
Actually, part of the Affordable Care Act now actually requires first dollar coverage for recommended cancer screening. So actually, if you have health insurance, no matter what kind, it should cover it without any cost to patients now.
Awesome.
So one of the past barriers was frankly the cost of screening, unfortunately, was pretty high for some people. So now it should be covered if you have health insurance. You can get cancer screening with no charge to you.
And so if somebody's watching this right now and they want to go get screened, what should they do?
Start with your primary care physician. They're the ones who can route you to where you need to go, but also if there's anything abnormal, they're the ones who can help get you plugged into where you need to be, whether it be the oncologist or the colorectal surgeon. And so start with your primary care physician.
There you go, definitely some good information. Thank you for joining us, Doctor. And we'll be right back. You're watching Channel 8 Eyewitness News Midday.